Thank you for being with us, sir. Let's start right here. 194K was the number. The estimate was 500. I don't want to start there. I want to start with the participation rate, 61.6. What's holding things back, Secretary Walsh, from your perspective?
You know, I go back to what I said last month. It's about the pandemic, and this is not just an American issue. This is a worldwide issue with participation rate in the workforce. You know, we clearly have more work to do. People are concerned about the Delta variant. People are concerned about their health, and I think, quite honestly, a lot of people are reevaluating their work-life balance and changing careers. And certainly, I would love to see more higher numbers. This was a very complex report. We looked at areas like the hospitality industry, where we had 74,000 jobs gained, but there was a direct correlation to not having more gains because of the Delta variant. And then we look at education, public education, and those numbers are far lower than what anyone anticipated. And I think that's really kind of what the forecasters were hoping for, seeing a larger participation in the public sector educational space. And certainly we're looking at that now. We're diving into that number now.
Well, let's dive into this one a little bit more. Female participation. Secretary Walsh, demand is fantastic. Open jobs in America just south of 11 million. What's the administration doing to support that return to work? What's the big effort you're looking at right now that you think can make an immediate difference? I'm not talking about a difference a year, 2, 3, 4, 5 years from now. That's important. But I want to discuss what we're doing right now for results immediately.
Well, I think schools are helping there. I think the schools being back in session. We saw the unemployment rate for women fall to 4.5%. We saw the unemployment rate for black women fall to 7.3%. So it's definitely going in the right direction, particularly where we were 3 months ago when we had 4 million women roughly out of the workforce. We're seeing lots more women come back into the workforce. That's a good sign for our economy. We need to continue that trend as we move forward.
Do you think that vaccine mandates are helping or hindering this effort?
I think it's helping this effort. There's no question. This won't hinder the effort. It'll help getting more and more people feeling confident going back into the workforce. Even folks that are refusing to get the vaccines, the more people that we get vaccinated, the more confidence I think it gives to everyone else saying, wait a second, I feel comfortable. I feel safe going back to a restaurant. I feel safe going into a store shopping. I feel safe going to work.
This is what the president had to say earlier this week. The Labour Department is going to shortly issue an emergency rule to require all employers with more than 100 people, whether they work for the federal government, to ensure their workers are fully vaccinated or face testing at least once a week. Can we start there? How receptive are employers to that message currently, Secretary? What are they saying to you?
I think a lot of employers just want to see what the rule looks like, the final rule, before they give their opinion. I mean, I think I've heard from employers that are saying, this is great, thank you for doing this, and I'm looking forward to it. And I've had roundtable with other employers saying, you know, we're a little concerned about what this looks like, what happens if we can't get people vaccinated, what happens if we can't get people tested. So we're going to be working through those over the course of the next several weeks.
How receptive are unions to that message?
I've gotten no pushback from unions. I think a lot of unions are realizing now as well that people want to get the economy opened up. They want to get people back to work. I think that's key. And they understand the safest way to get people back to work is by having people vaccinated. And people that don't want to get vaccinated, the safest way to go back to work is you have to wear a mask and get tested often. And the testing just shows that people don't have the virus.
And Secretary Walsh, we need to have some real outreach. And this is the final question on this front. How receptive are minority groups who have been hesitant to get the vaccine over the last year? The last thing we want is to deploy some rules that actually cuts off a part of society from being able to go to work, being able to go into a restaurant in New York City. What's the outreach like to minority groups? How receptive are they to things like a vaccine mandate?
There is no question. We need to do more reach out. We saw from the very beginning of the pandemic that communities of color, particularly the African-American, Latino community, were disproportionately impacted by the virus with higher rates of virus. And also there's a distrust in the medical system. So we have to do our work. We still have work to do. We're going to have to work with mayors around the country just to continue to build that trust.
Do you think there's a risk they will be disproportionately hit by these rules?
No, I don't think anyone's going to be disproportionately hit by the rules. This is across the board. This rule is for every American that is not vaccinated, that works for a company over 100 people, that the choice is going to be vaccination or testing.
Secretary Walsh, just a final question from me. I know it's a topic close to your heart. It's addiction. And I want you to talk to us about addiction and the importance of tackling and helping people with that issue right now. A lot of people have fallen out of the workforce. We need to do more to help them get back. Over the last 18 months, a lot of people have fallen into some pretty messy traps. I'm trying to understand from your perspective, a man who understands this far better than I and others, what can we do to help them?
First of all, thank you for bringing this up. I think, number one, reach out to people that are watching this today, and you might have family and friends that are struggling right now. Reach out to them, offer your hand to them, offer support to them. We need to try and continue to make more investments in treatment. We can't let people isolate. The pandemic has really caused a lot of havoc, and that's a perfect scenario for somebody who's struggling with whether it's substance use disorder or alcoholism or even mental illness or depression. Reach out to people. It's going to take all of us working collectively together. We've seen the overdose deaths in this country higher. I'd also ask companies that are watching today, give people a chance. Because somebody is in recovery or they're coming back into a program, don't cut them off from employment. Help them get back. They need to get back on their feet, and you can be a big part of that.